Hi, my name is Maureen Saleeb and I did my critique on the National Family Caregiver Support Program. The National Family Caregiver Support Program, also known as the NFCSP, was established in 2000 as an amendment to the Older Americans Act of 1965. Its main purpose is to assist families and other informal caregivers in caring for loved ones at home for as long as possible. It focuses on the caregiver versus care recipient. It also provides grants to states and territories based on their share of the population age 70 and over. As such, the NFCSP allows the states to determine how to allocate funding and oversee the programs for elder care. The program provides support services for the following. First, priority is to be given to the family caregivers of people who have been diagnosed with Alzheimer's disease and other dementia, including persons below 60 years of age with Alzheimer's disease. Family caregivers who are older individuals caring for people, including children with severe disabilities. Family caregivers are also those who are older individuals with greatest social and economic needs. Second, grandparents are older individuals that are relative caregivers of children under 19 years of age. Third, are the grandparents or relative caregivers providing care for children with disability who are between 19 and 59 years of age. These caregivers must be age 55 years of age and older and cannot be the child's parent. Services provided to these caregivers shall not be counted against the 10% ceiling for grandparents and other caregivers. Priority is also to be given to the family caregivers providing care for an adult child with severe disabilities. While the NFCSP offers the opportunity of home care to many families, the program has flaws that are continually being worked out year by year. First, the NFCSP is fragmented and irregular because it allows too many leeway for the states to decide how to allocate funding and how to determine eligibility for the program. Standardization of the NFCSP would help reduce the problems associated with program fragmentation. Second, the NFCSP lacks sufficient funds and has no accountable method of funding allocation. Third, the OAA does not hold any party responsible for program assessment. This means that the NFCSP funded programs are not monitored, and the funds could be wasted on programs and services that do not work. Fourth, the NFCSP is designed specifically to help caregivers, not the actual elders receiving the care. The program does not yet provide a standardized method of establishing training, education, and outreach services for the caregivers the program is designed to target. In other words, there is little in the way of support services, training, or education. The lack of support defeats the purpose of the program. Finally, the NFCSP needs to reach out more to the members of society who are in most need of financial assistance. The NFCSP currently lacks built-in provisions to ensure that the funding prioritizes low-income families. The NFCSP focuses on 5 basic service categories. Those 5 categories include information to caregiver about available services, assistance to caregivers in gaining access to services, individual counseling, organization of support groups, caregiver training, respite care, and supplemental services on a limited basis. Rather than dismantle the NFCSP, the federal government should work harder to strengthen these 5 initiatives. To do so, the federal government needs to partner more directly with state agencies and national healthcare organizations who can provide informed and evidence-based initiatives to build into future revisions of the NFCSP. Fragmentation has been identified as a primary problem with the NFCSP. The states determine which programs to fund, leading to great discrepancies of services and quality of care. Moreover, Families who move frequently or live in cross-border areas suffer from inconsistent application of the NFCSP. There is significant variability in eligibility requirements state to state, and also variation in processing periods for applying for funding. One suggestion to remedy the problem of fragmentation would be to reduce the red tape involved in applying for funding, making it easier for caregivers to understand eligibility requirements and to receive funding. There is also a lack of standardization in the programs available in each state. Some states might lack the leadership necessary to develop effective education and training programs for caregivers, causing great discrepancies in quality of elder care across the nation. States that do not pay adequate attention to the program development are currently not being held accountable for their shortcomings. A standardized application of the NFCSP would ensure quality of care delivery. As of 2011, the total funding of the NFCSP was listed at $153,911,000 and has remained quite steady over the past several years. The actual federal funding is not the problem. The problem is allocation of funding at the state level. Similarly, funding fails to provide for the tremendous income and access disparities. While the NFCSP fills a gap for low to moderate income family caregivers, the funding level of the NFCSP is too low to meet the complex needs of family caregivers. To create more meaningful reform in the elder care, the NFCSP needs to be more aggressive in centralizing its operations so that states cannot opt out of service provisions. There is as of yet no adequate control on state spending and no official method of evaluation of data collection. The potential for corruption and abuse remains a problem that can be easily addressed via methods such as program oversight. There is yet to be a clearly established uniform set of guidelines or evaluation procedures that can ensure that the program is working. Research explained that the difficulties faced when trying to measure the impact of the program services on families and ensure quality of the NFCSP-funded programs. There are inadequate controls on state spending of the program money and no official methods of data collection that would inform changes to the program and its support services. Future changes should focus more on outcomes, developing uniform standards across all states and a firm emphasis on evidence-based practices. The assessments need to keep in mind the target market for NFCSP services. Unlike other public health services, the NFCSP is caregiver-based and, as such, may require a different set of parameters for program evaluation. Caregiver support is the primary purpose of the NFCSP, and yet ironically remains the area that suffers most from inadequate management. The NFCSP has been revolutionary in offering caregivers of all ages the opportunity to acquire items and services needed for caregiving, whether those items are food and nutritional supplies or blankets. Family caregivers can benefit from receiving everything from incontinuous supplies and nutrition supplements to microwave ovens and washing machines that make daily tasks and routines a little easier. To reduce fragmentation in the program services and to increase quality of care, federal and state programs need to target the family caregiver. States differ on their approach and philosophy, with many failing to recognize that the target audience is the caregiver. Full reforms of the NFCSP would require state directors and local healthcare leaders to understand that the program is designed to help caregivers. Several issues have been identified with the NFCSP, including program design and eligibility, administrative structure, coordination, service delivery options, and systems integration. Additionally, the NFCSP has been widely criticized for its lack of training and education provisions. A revision of the NFCSP would specifically outline national education programs that are implemented at the local level. Finally, Worthington points out that not enough is being done to target low-income recipients of the NFCSP. To remedy this problem, the NFCSP would need to work more closely with healthcare organizations, faith-based organizations, and community outreach organizations to raise awareness of the NFCSP. Standardizing the NFCSP would remove many of the current barriers that exist in the service delivery. Funding, even if it were to remain at current levels, could be allocated more efficiently if programs were only evidence-based and targets to alleviate the burdens directly assumed by caregivers. Regular assessments of state-run programs would also ensure accountability and make sure that the funding has been allocated properly. Improving education and training for caregivers is the crux of the NFCSP and should be the future focus of the program. The National Family Caregiver Support Program could be improved by simple measures of standardization, assessments, and outreach services.